August 29th, 2003 or 2023 Norfolk Board of Health meeting in accordance with the governor's order suspending certain provisions of the open meeting law, Mass General Law, Chapter 30A, Section 20, related to the 2020 novel coronavirus outbreak emergency. The meeting at 7 p.m. Will be of those. Sorry. I'm balancing four screens here, sorry. At 7 p.m., the public meeting of the Board of Health shall be physically closed to the public to avoid group congregation. I will add that this is pretty much just a working meeting as we have no public hearings this evening.
That's right. So we can actually start off. So Liz, we have Pari, he's our new tobacco control coordinator from the Metro West Tobacco Control District. I think you met Olivia. So
Yep.
Anyway, so Pari, maybe you can just tell the board a little bit about yourself and what your role is.
Okay. Thank you for introducing me and having me here. My name is Pari Vallal Tale Govindan. You can call me Pari. So to tell about me, myself, I have a background in Ayurveda medicine. I have done my master's in psychology and master's in public health. And I was volunteering with Massachusetts Department of Public Health since COVID and volunteering with Medical Reserve Corps Framingham. So I've been joined in this new position, Tobacco Control Program Manager for Metro West District for past 1 month. So my responsibility will be educating the tobacco retailers regarding the state law and the Board of Health local laws, and stick to the laws and regulations on tobacco, sale of tobacco, and doing inspections, whether they follow the educational things. And then the compliance visit will be done by a trained youth under my supervision. So these are my responsibilities as tobacco control manager. If you have any questions, please you can ask me.
I guess the only thing is do you have anything scheduled like in the next couple months in the town, or are you just sort of making cold calls, or just following the old schedule of periodic, nothing set or nothing, no surprises yet?
No, as of now, I'm meeting the directors of, I'm responsible for 16 communities, including Marlborough City and Framingham City. So I'm meeting all the directors and getting their appointments as a tobacco agent for the town and cities. So once I do that, I'll be getting the list of retailers for each town and cities, and be contacting the retailers, letting them know that I am the new tobacco control manager for the region, introducing myself with the package and the signages which they should have with the package. And then I'll be coming up the list of areas and the retailers town by town, and with the permission and communication with the town of BOH, then I'll be starting my educational or inspection visits.
Okay, thank you.
Yeah. And to be informed, the complaints visit we are doing in collaboration with Health Resource and Action Organization. The youth will be trained under them and recruited by them. So that collaboration we're expecting to start with in the January 2024. Until then, the complaints visit will be held.
Okay.
Yeah.
Okay.
Thank you. Welcome.
Thank you.
Welcome.
We look forward to working with you.
Thank you so much. Looking forward to working with you all.
So Andy, that being said, we have a list of agent appointments.
I was going to ask you, I think I saw that email that you sent out that Carol thought that we could go to 3 years instead of doing this annually.
Yes, so she didn't see any reason why we couldn't do our appointments for a 3-year term.
Okay.
So these terms would expire June 30th of 2026. That will just make things a little bit easier so we don't have to keep doing reappointments on an annual basis.
Okay. So to confirm, we're looking at yourself, the Board of Health Executive Assistant, Carol Green, the issuer of burial permits, Matt Tanis, the public health agent, John Robertson, the Public Health Alliance health agent, primarily dealing with food establishments, Hillary Cohen as animal advisory agent, Ed Nolan, emergency preparedness agent, Pari, and I'm going to slaughter your last name, so I'm going to pass on that, but as the tobacco control program manager. And then again, John Robertson is a health agent update. And I guess that's, oh, sorry. No, that was the list. Sorry. I'm sorry. I have too many screens open here on this small screen. So, that's it. So it's basically just 2, 4, 6, 7 people, right?
Correct.
Okay. So should this be a motion to pass, or I mean, what's the best way to do it?
Yep, you can make someone can make a motion to appoint those 7 as agents to the Board of Health with terms to expire June 30th of 2026.
Okay. The only question I have is replacements would happen, you know, at when if someone either leaves or moves on to some other position. And I guess the other question I have is that with the Metacomet fund trust that we do have funds available, does that extend past 2026?
I believe it does.
It's for some reason 2028 seems to stick in my head for some reason. I'm not sure why. I thought it was like a 6 years worth of funding. So okay.
Yeah, I can't really confirm that, but.
Should I make a motion, or should Liz make the motion? Doesn't matter.
That doesn't matter. You can make the motion.
Okay. So I move to appoint Betsy Visual, Board of Health Executive Agent or Assistant, Carol Green, Town Clerk for issuance of burial permits, Matt Tanis as the Metacomet Public Health Alliance Health Agent, John Robertson, Metacomet Public Health Alliance Health Agent for food establishments, Hillary Cohen for Animal Advisory Agent, Ed Nolan, Emergency Preparedness Agent, and Pari. I'm sorry, I'm going to kill your last name.
No problem.
We'll just go with Pari.
Okay, I'm sorry. I'm sorry. Okay. So, so for a period for a period ending or expiring in on June 30th, 2026.
Perfect.
And I can second the motion.
Okay. If there's no further discussion, Andy Bakanowski, aye.
Liz Gebhardt, aye.
Okay, passes. Okay, we're good.
Excellent. Thank you.
Thank you.
So Andy, I had emailed you both earlier. I don't know if you saw it. John Robertson, our public health inspector, he was not able to attend tonight, but he did kind of put a list of some notes together on things that we've been working on since our last meeting.
Yeah, I saw that.
Yeah,
I did see it as well. Yes.
Yeah.
Awesome. So just to give you a kind of a little bit of an update. So we've been pretty busy.
Okay.
I don't know. Did anybody have any questions on that?
No, I mean, it's pretty straightforward. I have to admit, though, I was a little surprised to see that the farmers market we have in town does require certain, I guess, a review, which was kind of surprising, unless they're, well, so, if they're not, if they're making food or if there's packaged food they're bringing in. I'm just thinking because there was whoopie pies I saw there a couple weeks ago, or a couple months ago.
Yep. So those vendors do need to get a food permit with us. Okay. So we have the option for them to do a seasonal food permit, which is for 6 months. Okay. So that covers them for the period of the farmers market. Things, anything, fresh fruits and vegetables, uncut fruits and vegetables, such as, Ziegler's, do not need a permit. I think you can sell fresh eggs. excuse me, my cat was chewing on my mouse. So fresh eggs, they have to be kept at, I think it's like 40, I forget what the temperature is, but there are certain things, rules and regulations around farmers markets. But, you know, anybody that's selling baked goods and things like that definitely need a permit.
Okay. Okay.
And the food trucks are permitted.
Yeah.
They have food trucks there occasionally, so.
Okay. Okay.
So those have all been permitted.
Okay. I have nothing further to ask or talk about, or so. Liz, you all set?
Yeah, I'm all set. I didn't have any questions.
Okay.
Awesome.
Okay.
And then, as you know, Matt's not here tonight, but I know that you, Pari, yeah, thank you, Pari. You don't have to stick around. So Matt's not able to be here tonight, but I know that you and he are intending on working on continue to work on the well regulations.
Yep.
So we'll maybe have a draft maybe for the next meeting.
That's the goal. And Liz, just so you know, obviously the biggest expenditure associated with this rewrite is the cost to analyze for various tests. Based on the old regs, we're looking at some pretty basic testing, and that testing, which includes volatile compounds and metals and color, odor, taste, it's just the basic stuff that that you would find. Runs about $280, and then if you add PFAS in there, which is becoming the norm for a lot of locations, just because PFAS is found in a lot of different things, including fertilizers, which it's just a never-ending number of chemicals. That's about $900. So you're probably talking just around under $1,200 to do the testing. So just so you know, this is, it's not, it's information, but I guess my concern is like if you have someone that buys a piece of property and they waive any inspections or any testing, and then a year later, they find something, what happens then? So I guess that's something we'll have to talk about when we get to that point in the regulations, because if the both seller and buyer agree to waive any testing or any type of inspections or anything like that, it's basically it's buyer beware at that point. But there has to be a point where people have to realize that this stuff is pretty serious, and the standard, just so you know, for PFAS combined, all the different there's 6 different categories of PFAS, and the standard at one point was 20 parts per trillion. And that's where it is now. However, there's been discussions with the EPA and the state at the state level where they want to go down to 4 parts per trillion. And I kind of view, and I think I may have mentioned, what's a part per trillion if you look at a football field. It's an area that's less than 1/8 of an inch by 1/8 of an inch. That's 1 part per trillion. It's just it's a tiny fraction. And when you get 4 parts per trillion, and based on the health risks I've read, obviously it affects younger children ingesting this, and because it just bioaccumulates in their liver, and your body can't break it down. That's the thing. And the technology exists to remove it from groundwater, and that are the drinking water sources, but that's something that the technology is still not where it needs to be for the small household system. For municipal systems, it's expensive to run because they're using primarily carbon, or there's a couple other means of removal. It uses polymers and resins, and the technology is significantly more expensive than carbon. But at the same time, the cost to turn that around, meaning cleaning that and swapping out vessels, it's not only cost, but it's also time, because you're talking a year's lead time for some of this stuff, just because the demand is so high across the country. So this is not an easy issue to tell somebody. It's like, you got to do something. So, but we'll cross that bridge when we get to it. But again, like I said, Matt and we've been talking about it, and you know, I think we're just trying to lay stuff out, and you know, it's going to probably be discussed heavily over the next 6 months or so. That's my guess. So. Okay. Okay. Southwood Hospital update. A report just came out last week, which is what was called the phase 1, phase 2 scope of work. A year ago, they did find PFAS above reportable concentrations, and I have not looked at it. It's several hundred pages. I did skim the summary tables on what's out there, and yes, there's PFAS out there, but in terms of the distribution of it's pretty limited. But at the same time, the other things they've detected, mostly associated with number 6 fuel oil, that's pretty widespread across the property. You know, that's going to have to be dealt with when they do remediation of the property. Some of the well monitoring wells that they did test or they did check could not be sampled because there's floating oil on them. And you know, this has been like this for 23 years. It's just not it's not really moving, obviously, but at the same time, it's all going to have to be addressed. And looking at the timetable that was set before the PFAS was found, they were looking at 2027. So you're talking 4 years from now before they may reach a final solution. So we'll see. So. And then on Buckley and Mann, nothing's going on there. Nothing. There's been no new test data. There's been no real activity going on. So I do know that the planning board was to meet with representatives of the family, but that was postponed until another date for some personal matters. So, but that's all I've got. So,
next meeting is I've got September 26th.
Okay, works for me.
Okay.
I think I'm good.
And then I think we've just got the were you able to review the meeting minutes from May 30th?
Yeah,
which was our last meeting.
I reviewed them. I have no comments, no issues with them as written. I don't know if the sync was ever put in though. But I guess we can follow up after the meeting and see if the sync was put in.
At the Grange?
Yeah.
I haven't heard anything yet.
Okay.
So at this point, they don't have an active food permit. So if they were to come to us to apply for any kind of a food permit, then we would, that would have to be in place.
Okay. Yeah, I noticed they had something early in August. They had an event early in August, and that's it. And I think were they shooting for twice a month? So yeah,
they advertise it as a potluck event, I'm assuming.
Yeah.
So,
okay. I would say just I'll see if we can track down, see if a sink was put in. I mean, I can obviously they would have had to pull a plumbing permit, and we can check over there at the building department, see if that happened.
Yeah, I can check on the Citizen Serve online permitting too. Okay. But we can check okay. On that.
Okay. So Betsy, I guess for the next meeting, is anything coming down the pike of interest, or is this simply just
I do not have anything on the books as of yet, Andy.
Okay. Well, it's just been a quiet summer, I guess. That's a good thing.
Yeah. No, we haven't had. Yeah. We haven't had any septic variances.
We like boring.
Yeah, I know. So I mean, it's great because everything, anything is pretty much being handled, in office and hasn't needed board, hasn't needed the Board of Health members. So which is okay.
Okay.
So we're keeping busy.
Okay. Liz, do you have anything you want to talk about? I mean, we got to, if we can stretch
No,
this to
I don't
maybe
know what's going to
7:30.
happen with the resurgence of COVID cases, but we'll have to cross that bridge when we come to it. Some of the hospitals are having people put masks back on. Our sturdy is not in the offices, just in the hospital. So I'm not sure where we'll go with that.
Well, I have to admit, I was in Newton and actually stopped into one of the strip malls parking lots, and I noticed a lot of people wearing masks. And this was Newton, and this was there's a grocery store and other things there, so it was noticeable enough, because usually you'd see 1 or 2 people occasionally, but I would say if it was 10 people, could have been 20 people that I saw masks.
Yeah.
So yeah, so there's definitely, and my wife's in Boston at one of the hospitals, and they're noticing an uptick in COVID as well. So
We do a flu clinic, right? Or no?
Yeah, the senior center in October. I can't remember the exact date.
Okay.
I think it's in the first week. So the nurses will be advertising that.
Do they do COVID with it as well, or they just stick to the flu?
I don't think so. I think it's just flu, but I can check.
Okay. I was just curious.
Liz, have you heard anything about a combo vaccine, both
They
flu and
talk
COVID?
about it, but I don't know if it's going to go through, because a lot of people, my patients anyway, are sick of COVID shots. So I don't know how the duo will go over, because some people don't want, like I have people that just don't want another shot.
Yeah.
So to combine them, you might lose money, waste, because people will only want them separated.
Yeah.
Okay.
There has been talk, though. Our infectious disease doctor didn't have any dates on it, though. She had a lecture the other day.
Okay. Yeah, I mean, I'm due for my COVID shot at some point, but it's haven't heard anything other than what my primary care physician had said, that it's possible by the end of the year they could be a dual shot, but I don't know. So, okay.
Yeah. But if you're waiting until the end of the year, then it's like, are you missing half the season? I don't know.
Yeah.
Well, most people get them around end of September, early October, for the flu anyway.
Okay.
That's all I got.
Oh yeah, I just need a motion on those minutes.
Oh, I'm sorry.
That's okay.
Make a motion to approve the meeting minutes from May 30th, 2023.
I'll second the motion.
Okay. Andy Bakanowski, aye.
Liz Gephardt, aye. And then, do we need to make a motion to adjourn this meeting? Is that what it is?
We do.
Yes, we do.
Yeah, 7:29.
Liz, just so you know, once Betsy finishes those meeting minutes, that you'll need to go in and sign.
Yeah, I know. I thought about that too.
No, there's no hurry. So
yeah.
Okay. I'll pop in. I have to bring in that other paper you sent today too about discrimination.
Oh God, the anti-harassment and discrimination policy.
Yeah, so I'll do it at the same time. I'll drop it and sign what I need to sign.
Perfect. Thank you so much.
Okay. Well, I'll second Liz's motion to adjourn at 7:30.
7:30.
Okay. So
Liz Gephardt, aye.
Andy Bakanowski, aye. Okay.
All right, so I'll see you by September
Thank you.
26th, you said, right?
Yep.
Okay.
Nice.
All right.
Thanks for the nice quick meeting.
Thank you.
Have a good night.
All right.